So hello, I'm Dr. Sujata Gupta, and we have with us Dr. Waifu, who is a renowned fertility specialist and endoscopic surgeon working in the Origin Fertility Center in Yangon, Myanmar. আপনারা জানেন যে মার্চ হচ্ছে এন্ডোমেট্রিওসিস অ্যাওয়ারনেস মান্থ। এই মাসে আমরা একটু এন্ডোমেট্রিওসিস নিয়ে আলোচনা করব, বিশেষ করে এন্ডোমেট্রিওসিসের যে ল্যাপারোস্কোপি তার কি গুরুত্ব সেটা। Okay, Dr. Few, so for our patients or for our audience, can you please tell little about what is mean by endometriosis?
Okay, so endometriosis we have encountered with so many patients, especially in infertility clinics. The endometriosis is in a woman, so your womb have a linings that we call the linings of your womb. That should be placed in your womb, but that will be placed instead outside the womb, like the tubes and ovaries, and sometimes in the your cats and those things. There's abnormal placings of your linings and to the other place. There is endometriosis.
Okay. So this is, we know, endometriosis, as you say, endometriosis is associated with infertility.
Yes.
So what are the treatment options that a woman can have for treating endometriosis?
Okay. First of all, you can modify your lifestyle. You can reduce your weight and do some exercise and yogas and meditations that can reduce the pains associated with the endometriosis. Another thing is you can start the medications that over-counter treatment like the paracetamol, ibuprofen, and those things you can take. Another one is contraceptive pills, and that can also reduce your pain associated with the endometriosis. And if all the treatments are failed, so we have to do some surgeries. In surgeries, we can do the excisions or ablations of the endometriosis.
So how surgeries are done? Is there open surgery or laparoscopy?
So nowadays, we usually do the minimally invasive surgery. We usually do the laparoscopy. There is a keyhole surgery. There is a small incisions in your tummy, and we can do that.
Okay. So what are the advantages? Why people should do this endometriosis surgery by laparoscopy rather than open surgery?
Okay. The keyhole surgery is we need only the small incisions. The old days we usually do the large incision. So the keyhole surgery have a rapid recovery and short hospital stay. Even you can do the take care procedures, and also the reduce the pain after the procedures, and you can do your routines quickly. And also it is with the magnifies the findings, and so we can excite all the endometriosis tissue completely with the keyhole surgery.
That is, complete removal is more possible with laparoscopy rather than open surgery.
Sure.
So many people ask where we should do this surgery, which center or which clinics, means where we should go for laparoscopic surgery for endometriosis.
Yes. The endometriosis is not a simple disease, and it can affect all the pelvic organ as well as the bladders and as well as the GI tract. So you have to go to the very dedicated surgeons who is routinely doing and expertly doing the endometriosis.
That is, only the skilled person should do it.
Okay. Yes.
So what are the complications that can happen during this laparoscopic surgery for endometriosis?
Okay. First of all, before you doing the surgery, you have to know the complications. There's one thing is the most common thing is the fevers, and sometimes you can have infections. And another thing is if endometriosis is infected and there's a pus in there, sometimes you have to remove the your ovary, and also that there's a bleeding is always there, and sometimes it's a very complicated endometriosis infiltrated into the bladders and GI tract. There can also injuries to the nearby organs and like the bladders and GI tract. You may need another procedures.
So how do women recover after endometriosis? Means endometriosis surgery. After laparoscopy, how quickly they can return back to the normal life, or should they have any restriction?
Okay. The laparoscopy is a minimally invasive surgery, so you can recovery very quickly. But mostly after the 1 week, you can recovery fully, and you can do all your routines. And as I already mentioned, it, that surgery can do the take care procedures, so the recovery time is very quick. But depends on the how severe it is of your disease, and that's depends on that.
And also the complication.
Yeah, complication.
Okay. Now, if a woman is planning for pregnancy, and if she has undergone this laparoscopic surgery for endometriosis, what advice will you give to them after surgery?
Okay. As I mentioned, it depends on how severe it is, and sometimes if there is a severe endometriosis, we usually recommend the hormonal therapy after the surgery to completely remissions of the endometriosis. So it may need maybe 3 to 4 months. But if you have a mild or the stage 1 or stage 2 endometriosis, you can start the for the conception.
That is, you should not delay conception.
Yeah, you should not delay.
Thanks a lot. Thank you, Dr.
Thank
Waifu.
you. Thank you.
And you must be glad to hear that recently one of our patients, they are residing in Yangon, Myanmar. They consulted with us online, and we referred the patient to Origin Fertility Center. And this patient conceived with simple ovulation induction. Now they are continuing the pregnancy. So thank you all.
Thank you all.
Thank you.